All right, today we're putting on our detective hats to solve a really complex medical case, the perplexing and often misunderstood condition known as Cushing's syndrome. So, let's start with a question. What happens when your body's stress hormone, the one that's supposed to help you in emergencies, just runs wild? Imagine that emergency response system, the one that kicks in when you're stressed, suddenly gets stuck in the on position. This isn't science fiction, it's the real question at the heart of our mystery today. It's a condition where a single hormone goes rogue and throws the entire body into chaos.
You know, every good mystery starts with a set of clues. And in this case, the clues are coming from the body itself, but they're confusing, and they seem totally unrelated. A person might notice their face getting all round and puffy, or a strange fatty lump appearing between their shoulders. Or maybe they see these wide, deep purple stretch marks on their skin. These are the very first signs that a powerful system inside the body has gone completely haywire.
Okay, so these aren't just random things happening. They are definite warning signs. Let's start to unravel this mystery.
And here's the kicker. All of these totally different clues, they all point back to one single culprit, Cushing syndrome. It's a serious disorder, and it's all caused by being exposed to crazy high levels of one specific hormone for a long time.
Now, you might be thinking this sounds pretty scary, but it's actually really rare. We're talking only about 2 to 5 new cases for every million people each year. And what's interesting is it has a clear pattern. It usually shows up in women who are between 25 and 45 years old, so that helps us narrow down our investigation a little bit.
Okay, so we've identified the condition, now it's time to name the actual culprit behind all this hormonal chaos.
And here it is, cortisol. You've probably heard of it, right? The stress hormone? Now, when it's at normal levels, cortisol is your friend. It's essential. It helps your body use fats and proteins, it keeps inflammation in check, it even helps regulate your blood pressure. But with Cushing syndrome, that whole system just breaks. The best way to think of it is like your body's thermostat is busted and stuck on full blast, just flooding your body with cortisol 24/7.
So, the big question is, where is all this extra cortisol even coming from? Well, it basically boils down to two primary scenarios. About 3/4 of the time, it's what we call ACTH dependent. The other quarter of cases, they're ACTH independent, and trust me, telling these two apart is absolutely critical for finding the source and the right solution. And this slide just nails the difference. Think of it like this. The command center problem is the most common one. Your pituitary gland is like a general, and it's just sending out way too many orders, this hormone called ACTH, telling the adrenal glands to make more cortisol. On the flip side, you've got the rogue factory problem. In this case, the adrenal glands themselves, the factories, just go rogue. They start pumping out cortisol all on their own, completely ignoring any orders from the command center.
Okay, so we know what could be causing it, but how do doctors actually prove it? This is where we follow the clues, the diagnostic trail to crack the case for each and every patient.
Doctors follow a really logical 4-step process. First, they run some initial screening tests, often using urine or saliva, just to see if cortisol levels look off. Second, they have to confirm that it's a consistent ongoing problem. Step 3 is the big one. They check that ACTH signal to figure out if we're dealing with a command center problem or a rogue factory problem. And finally, step 4, they bring in the big guns, MRI or CT scans, to pinpoint the exact location of the source, which is usually a tiny tumor.
And this really gets to the heart of why this detective work is so vital. Cushing syndrome doesn't just show up overnight. It's insidious. It creeps up on you, with symptoms developing slowly over months, sometimes even years. And that makes it a massive challenge for doctors to connect all of these seemingly unrelated dots.
So, once the source has been found, the final act can begin. It's time to target that source and finally put an end to all this hormonal havoc.
What's so amazing here is that the treatment plan is tailored exactly to the cause they found during the investigation. So if the problem is a little tumor in the pituitary gland, surgeons can often go in right through the nose to remove it. If it's a tumor on an adrenal gland, you guessed it, that gland is removed. The treatment directly targets the source.
And the results are often pretty remarkable. For the most common cause, those pituitary tumors, surgery leads to remission in about 80% of cases. That's huge. It means that for the vast majority of patients, cracking the case and removing the source can lead to a cure. But you do see that 20% there. There is a risk it can come back, so long-term monitoring is key. But we have to talk about the stakes here, because they are incredibly high. This number is chilling. If this mystery is not solved, if Cushing syndrome is left untreated, the 5-year mortality rate is over 50%. The constant, crushing overload of cortisol just wreaks havoc on the cardiovascular system, leading to things like heart attacks and strokes. This really underscores why getting that diagnosis and treatment is so critical.
The case is solved. The source is removed. But the story isn't over. Let's look at the final chapter, the long road to recovery.
I mean, think about it. After living with that cortisol overload for so long, the body's entire hormonal system needs time to reset and recalibrate. You can't just flip a switch and go back to normal. Recovery is a marathon, not a sprint, and it often takes many months or even a few years for a person to feel completely like themselves again.
A successful recovery is a really active process. It means carefully weaning off steroid medications on a strict schedule. It means being super vigilant for any signs of infection since the immune system has been compromised. It also involves adopting lifestyle changes, like a healthier diet and gentle exercise, to rebuild the body. And of course, regular follow-ups with a hormone specialist are absolutely essential.
You know, when you step back and look at the whole picture, solving the mystery of Cushing syndrome reveals something really profound about our bodies. It shows us how a tiny tumor causing just a microscopic hormonal imbalance can create system-wide chaos. It's a powerful reminder of the incredibly complex and delicate dance of hormones that, most of the time, work perfectly in the background to keep us healthy and in balance every single day.